Hi, and welcome to the Wayne Lamos podcast. I'm your host, Wayne Lamos, and this is episode 3 Understanding Nutrition and Depression for the Common Man from the mini series Getting a Handle on Depression. First, a quick disclaimer. Please do consult a registered dietitian or nutritionist and/or your medical specialist before making any changes to your diet. Conditions such as diabetes, thyroid conditions, cholesterol issues, and blood pressure issues require expert consultation, and I will not be held responsible if you go ahead without that consultation and if something does happen to you. Here we're going to have a quick look into nutritional mentions: omega-3, vitamins B9, B12, B6, B3, creatine, and resveratrol. And we start off with omega-3. Here studies have shown that omega-3 polyunsaturated fatty acid, or PUFA for short, that's PUFA, more so the EPA than the DHA, had a beneficial effect with MDD, major depressive disorder. Here in particular, persistent depression, MDD in children, and bipolar disorder. Here not discrediting omega-3 DHA, which played a role in aiding in minor depression, postpartum depression, and suicidal ideals, which both had lower levels of EPA as well as DHA. Here we note the difference in fish and seafood sources of omega-3 as compared to walnuts and flaxseed sources. Omega-3 found in plant sources is a parent omega-3, that's ALA, alpha-linolenic acid. This metabolizes in the liver to EPA and DHA. However, in human beings, only about 5 to 15% is converted into DHA. Next is vitamin B9, also called folate or folic acid. Vitamin B9 plays a role in the synthesis of RNA and DNA and has anti-inflammatory properties shown to reduce homocysteine levels. High homocysteine levels can cause cerebral vascular diseases, neurotransmitter deficiencies, and disruptive moods, speculated to be caused by the first two just mentioned. We can understand this better by seeing that homocysteine is toxic to endothelium, which forms the inner cellular lining of blood vessels. Hence, homocysteine is also related to vascular heart disease. Next is vitamin B12, also called cobalamin. Among its many functions, here we are looking at B12's importance in the role of synthesis and maintenance of myelin. Myelin is an insulating layer or sheet around your nerves. It allows for efficient transmission of nerve signals. A deficiency of B12 is linked to demyelination, a condition of damage to the protective coating of nerve fibers. Demyelination caused in the limbic system is linked to depression. Moving on, we have vitamin B6, also called pyridoxine. Vitamin B6 is needed for the creating of neuroreceptors. Those include serotonin, GABA, dopamine, all three of which in lower levels are related to depression and symptoms of depression. Also, a quick mention over here is vitamin B3, niacin. While it is stated that there is no evidence that this vitamin aids directly in depression, the vitamin does play a role in aiding against anxiety. And as we have seen, anxiety, depression, anger, and everything to the symptoms are all correlated and interlinked. Moving on, we move on to creatine. The supplemental form has been extremely popular in the physical fitness industry for decades now. However, our interest over here is in depression and primarily looking at it from a neurological point of view. Creatine is an organic acid and it can be found in meat. Here we note that while the brain accounts for only 2% of body mass, it utilizes about 20% of body energy. Now, with regards to major depressive disorder, it can be seen that creatine does have antidepressant qualities. However, here we also have to take into consideration that creatine does have a role in the production of DHT, that's dihydrotestosterone, which is linked to aggressive behaviors and male pattern balding. Here, DHT blockers such as spinach and pumpkin seeds may help. However, creatine has also been linked to cardiovascular issues, which have also been linked to low fiber diets where high fiber or rich fiber diets may help. Although I would strongly suggest that a medical practitioner or a registered nutritionist is best consulted before implementing creatine into any diet plan. Next on our list is resveratrol. Resveratrol is a polyphenol found in grapes, cranberries, blueberries, and coca found in dark chocolates and red wine via grapes. Resveratrol has neuroprotective properties, meaning it aids in inhibiting amyloid aggregation, specifically Beta amyloids. Beta amyloids have been studied to be a cause of formation of brain plaques. They induce cytotoxicity, which is toxic to cells. Here, amyloid protein deposits in the nervous system have been linked to amyloid depression. However, amyloid-associated depression has been suggested to be linked to Alzheimer's disease, AD. Here, another study did show that resveratrol did improve spatial memory performance, a conclusion that regards to the hippocampus, resveratrol administration inhibited neuroinflammation, apoptosis, that's a type of cell death, inhibited oxidative stress, as well as increasing hippocampal BDNF, brain-derived neurotrophic factor, and beta-catenin. Beta-catenin is involved in the neurogenesis process. And that's the end of our nutritional mentions, but please note that there are many others. Also, please do refer to episode 3 in series 1 and in series 2, that's anxiety as well as in anger. As you have seen already from the early episodes in this particular series of depression, anxiety and anger are also symptoms in depression, and nutrition in the same would play a role also in those symptoms. In this episode and in past episodes on nutrition, we mentioned the mechanisms of nutrition in correlation with the disorder so that a person understands the vital role that nutrition plays and do not discredit nutrition and go more for medications with no importance given to nutrition. In fact, studies have shown that depression has been linked to poor diet. And that's it for this episode of the Wayne Lemos podcast, recorded for community and recorded for you. We will be talking about coping skills in depression in the next episode, so do look out for that. Till then, I'm your host Wayne Lemos, saying goodbye and thank you for tuning in.